Hello, and welcome to our Kids Cafe program evaluation. This presentation was created by Jada Bailey and Justin Clancy.
Program background. The Kids Cafe program was first started in 1989 as a national initiative by America's Second Harvests. Like many programs, it has an aspiring initiative with the goal to make positive changes and significant impact in adolescent lives. The program goal states that it seeks to alleviate child hunger by providing low-income children with free and nutritious meals and snacks to students during after-school hours. In 2016, Kids Cafe served over 27 million meals through 6,500 site locations. The program aims to achieve this by creating cafe sites in numerous locations in conjunction with existing community programs in various locations such as churches, shelters, and after-school centers, such as Boys and Girls Clubs and YMCA, nationally in school districts that have higher rates of food insecurity. By creating a safe environment where children can receive care and nutrition, it aims to reduce the effects that food insecurity has on children. The objectives that the program states to achieve this goal are providing safe environments, providing educational, recreational, and social activities, and provide nutritionally balanced meals. Purpose of the evaluation. The health problem that this evaluation will focus on is food insecurity. In 2016, the United States Department of Agriculture estimated that 13 million children in the U.S. live in food insecure households, with nearly 18% not having consistent access to enough food for an active, healthy lifestyle. Improving food insecurity has been a priority to help improve the overall health outcomes. Households' food insecurity has an adverse effect on the health and development for adolescents. The risks include hospitalizations, poor overall health outcomes, developmental risks, behavioral problems, primarily aggression, anxiety, and depression. Healthy People defines food insecure as the disruption of food intake or eating patterns because of lack of money or other resources. An evaluation is needed to improve the quality of the program, the effectiveness of the program procedures in order to continue to expand the program to reach more adolescents. In a literature review, the authors found that longitudinal school-based studies reduced the odds of child food insecurity by 74%. However, interventions that attempt to increase consumption of fruit and vegetables measures effectiveness in terms of achieving the aim, while ignoring the potential wider impacts that may positively or negatively have on the child's outcome. To help bring awareness to the environmental, social, and behavioral factors that influence adolescent food insecurity throughout the country, our evaluation will focus on assessing its nutritional, educational, nutritional balance, and the overall economic impact that it has on families. The evaluation will contain several mixed method approaches using design methods and data collection tools.
The following logic model pictured here represents the Kids Cafe program process to outcomes starting from left to right. Inputs to the program, such as funding, site eligibility, and access to local food banks, initiated the likes of nutritional education classes, after-school meals for students, and summer grab-and-go meals. These activities translated to meals provided at after-school locations, food options for low-income students, one-on-one student interaction services, and 60-minute weekly courses aimed at well-balanced diets. The outcomes in the logic model revolved around families' ability to save money, the students' self-efficacy to improve their lifestyle, and the habits of school-aged kids to encourage healthy eating habits. From this logic model, we were able to configure evaluation questions off of several areas of focus circled here.
Our evaluation will focus on 3 questions that were pulled from our logic model. The first question is, how well do the nutritional classes adhere to the syllabus? This question comes from the activity section of the logic model. One goal of the evaluation is to increase adolescent awareness of the importance of healthy and balanced food options. Kids Cafe offers one nutritional educational course where faculty volunteers use a syllabus to educate the students. Our evaluation will seek how well do the program instructors adhere to the nutritional education syllabus to make an impact. Number 2, how is the quality of the nutritionally balanced meals? This question comes from the outputs of the logic model. This program goal of the evaluation sets to increase how the eating habits of the nutritionally balanced meals provided to the students change throughout the course of their time enrolled in the Kids Cafe program. The evaluation will seek to evaluate this objective by monitoring through observation and interviews how the Kids Cafe program is received by participants and how it correlates with an increase in consumption. And number 3, how are families able to utilize the money saved from the benefits of the Kids Cafe program? This question correlates with the intermediate outcomes section of the logic model. This evaluation goal seeks to have a positive impact on the environmental factors by seeing how the participation in Kids Cafe program impacts the economic stability of the household of the student participants. This evaluation will seek this objective by utilizing a longitudinal study to follow households over a 10-year span to observe how the monthly budget changes over time. Evaluation question number 1, purpose and design. The evaluation question, how well did the nutritional courses adhere to the syllabus? The purpose of this question is to see how well the course instructors follow the syllabus provided. This question posed by the evaluation looks to see how well Kids Cafe sites across the country will stick to their evaluation plan that is laid out. Adhering to the material that are provided are important because the objectives that are provided are used to be able to maximize the participants' self-efficacy to improve their eating habits. All Kids Cafe program sites have a syllabus and course materials that are given to students to guide them through the course material. Due to the numerous site locations that operate Kids Cafe program, variation in how the course material is delivered to students is nearly inevitable. The evaluation team chose an evaluation design that would be best suited to determine the delivery of the course materials and how they vary across numerous site locations. The evaluation design that is best used to address this question is a qualitative case study. 25 Kids Cafe site locations were selected through numerous locations around the country. The sample size was selected to adequately represent 5 sites from the 5 regions across the country: Northeast, Atlantic, Midwest, Southwest, and Pacific Northwest. The site location requires to incorporate a minimum of 1 nutritional educational course each month to adhere to site requirements. The selected site locations were given video equipment to record their nutritional classes over a 6-month span to gauge a wide range of numerous objective topics. The recordings of the lessons were then submitted monthly to an evaluation team and review with the evaluation committee, which comprised of an evaluation team member, a certified health education specialist, and a community member from the selected site location. The evaluation committee was comprised to be able to best provide insight and effective communication on program material. Evaluation question number 1, data collection and evaluation tools. The qualitative data collection methods that were used for this question were recorded observation of the course from the selected sites. The observations that were recorded were then submitted to the evaluation committee, which was previously mentioned, on a monthly basis over a 6-month span. The committee followed the protocols that were given to them through the syllabus to see the variation that each site had in their programs and what were the effective means of communication to their student population. The evaluation tools that were used were interviews with the students to gauge their engagement and self-efficacy. Once the observations were followed up with interviews of the class participants, the student interviews with a series of questions that were geared toward how well the students in the recorded sessions received the information. To keep consistency across the classes in all the site locations, the average class size of each case study was 10 student participants.
Evaluation question number 2, purpose and design. The purpose of our second evaluation question is to assess the overall quality of the meals that are being consumed. One of the benefits the Kids Cafe program promotes is providing a nutritionally balanced meal. While this sounds great in theory, just because a meal is nutritionally balanced does not mean the meal is of quality standards. Poor quality food leads to less consumption. Less consumption equates to wasted food and a waste of resources. Therefore, this evaluation question ultimately serves to assess whether or not the meals being provided are worth the time and resources. This evaluation question will be addressed through a mixed method approach, including qualitative evaluation tools and an interrupted time series design. This approach allows the program to function throughout the course of the year while also simultaneously collecting data and feedback. Periodically, throughout the year, the menus will be assessed for the overall food consumed versus the overall food wasted. In addition, one-on-one interviews as well as focus group sessions will also be held throughout the year to gauge individual opinions of the quality of meals. Evaluation question 2. Data collection and evaluation tools. For each respective day, there will be a limited amount of food designated to the individuals who are participating in the program. This will be configured through data calculations including the number of overall individuals, the various age groups of the individuals, and the total budget available. The time series data will focus on total amount of food left unconsumed for each week, which can then be quantitatively converted to a percent of overall food left over. This then gives the ability as evaluators to compare the food consumed versus unconsumed on a weekly basis. From here, we can turn to interviews and focus groups in which evaluators can gauge the participants' opinions of the overall food. These would occur on a quarterly basis in order to give an adequate amount of time to assess progress. Topics of discussion would include the likes of average hunger on a given day, actual food taste, personal food preference, and the likes and dislikes of the meals provided over the course of the respective time period. The combination of the percent of food left over and the data collected from the interviews and focus groups will give evaluators quantitative and qualitative data to analyze the overall quality of food. Evaluation question 3. Purpose and design. Studies have mentioned that the influence of environmental factors play an impactful role in food insecurity. The study looked to understand how the implementation of the Kids Cafe in various communities impacted the family's monthly household budget over a 10-year span. In order to grasp the effectiveness of the program with this concept, we chose to analyze this evaluation question, again using a mixed method approach, but this time including a longitudinal design and a series of annual surveys. In this approach, families participating in the study would be followed through the years and scrutinized in relation to the financial impact of the program. Each of the families would allow insight to their overall direct savings from the program and the financial opportunities it has opened up for them. Evaluation question 3. Data collection and evaluation tools. Being that this type of study would require a significant amount of time, this particular longitudinal study would need to be prospective. Data would be collected on an annual basis through surveys addressing several financial areas of topic. They would include the likes of overall program impact, financial flexibility, ongoing new and expired financial hardships, monthly and annual budgets, and lifestyle changes that this program financially had an impact
on. Outcomes. After the completion of the evaluation team hopes that the findings from the evaluation will provide the following. Number 1. Improve the quality of the services provided through Kids Cafe program. This outcome will help continue the national support of throughout the country, allowing for the expansion of more Kids Cafe locations in order to reach more adolescents. Number 2, create a standard across all site locations, ensuring that there is a standardization of all of the Kids Cafe's benefits in order to improve the self-efficacy and help with long-term reduction of food insecurity issues. And number 3, provide data to help support further community outreach. With a stronger structure of the communications of the program, the evaluation hopes to allow more community support through local businesses such as food banks and other partnerships that could potentially come from the program in order to provide materials to children in their local areas.
Presentation to stakeholders. In regards to our stakeholders, we plan on comprising reports on a quarterly and annual basis, as well as biannual meetings. This will ensure there are consistent updates throughout the year and will allow optimal time if any adjustments are needed. Thank you for your time. Please see references used throughout this presentation.